Just before we start, I'll just say I've had this problem with recurrent laryngitis, so my voice isn't brilliant, so I hope it lasts. I want to ensure that New Zealanders don't have to continue waiting as long as they do now for essential health services that they need and deserve. In my view, the shortest wait is the safest wait, and our most urgent and critical priority is to reduce waiting times. There's some that actually get a lot of public attention, like waiting times in the emergency departments, waiting times for specialist appointments, waiting times for surgery, and all of those are very important and they will be highlighted. But there's other waiting times. The waiting time when you're ready to be discharged and that takes a few hours, or waiting time to see a general practitioner. So I just want to stress that from my point of view, the absolute and most urgent priority of the next few years is actually to get waiting times down. I firmly believe that we can deliver a lot more healthcare out of the actual resources that we have now. Because if we can use the resources we have in the most optimal way to provide as much healthcare as possible, then people who are waiting will have to wait less times. So yesterday you would have heard that financial performance of the organisation has tanked in more recent times, and that if that continues, we would face a very significant, characterised as 1.4 billion deficit next year, which is entirely unacceptable. One of the problems is that when you have a look at all of that, the uplift in output services and outcomes for patients has remained relatively flat. And we need to address that because the New Zealand taxpayer needs to get more value for their investment into healthcare. We want to be an organisation defined by our opportunities and not by our problems. And we will deal with that. But I just want to stress the primary focus is on doing more and doing better for our patients. Health New Zealand Te Whareura is a big organisation, and in my view it is quite a bloated bureaucratic organisation, and we want to turn this into a health delivery organisation, totally focused, all its resources, all of its energy going to supporting that front line who actually deliver all of the services. We intend to be actually quite transparent about all of this. And I'd be happy in a little bit of time, once we're a bit further into, to have this kind of stand-up again. We're happy to be open about what we're doing. We just need to clarify. We have got a plan that we have to have with government quite soon, and we're hoping to bring these regional people on very quickly because they're critical to all of this.
We'll certainly be publishing the national health targets, performance by region and by district, so local people in their community will see how their regional team is helping them achieve those short wait times.
Thanks everyone.
Thanks very much.
Professor Levy.